Born on May 12,820 in Florence, Italy, Florence Nightingale was named after the city of her birth. She grew up in an affluent British family, receiving a comprehensive education that was rare for women of her time. From a young age, Florence demonstrated a sharp intellect and a deep sense of purpose. Despite societal expectations that she would marry and lead a life of leisure, Florence felt a divine calling to serve others through nursing. Her decision to pursue nursing was met with resistance from her family, as the profession was considered unsuitable for women of her social standing. Undeterred, Florence dedicated herself to studying healthcare practices, hygiene, and hospital management, laying the foundation for her future achievements.
In 1854, the Crimean War erupted, and reports of appalling conditions in British military hospitals reached England. Soldiers were dying not only from battle wounds, but also from infections and neglect. Florence Nightingale answered the call, assembling a team of 38 nurses to travel to the war zone. Upon arriving at the British base hospital in Scutari, modern-day Istanbul, Florence encountered horrific conditions: overcrowded wards, unsanitary practices, and a lack of basic medical supplies. Determined to make a difference, she implemented sweeping reforms. She improved ventilation, ensured cleanliness, and introduced organized care practices, dramatically reducing the hospital's death rate from 42% to 2% within months. During her nightly rounds, Florence carried a lamp as she tended to patients, earning her the nickname the Lady with the Lamp. Her compassion and dedication became a symbol of hope for the wounded soldiers and an inspiration to people back home.
Florence's experiences during the Crimean War galvanized her mission to reform healthcare. Upon her return to England, she used her fame and influence to advocate for systemic change. In 1856, she presented a detailed report to the British government, highlighting the need for improved sanitation and hospital conditions. Her efforts led to the establishment of the Royal Sanitary Commission and significant reforms in public health. In 1860, Florence founded the Nightingale Training School for Nurses at St. Thomas's Hospital in London. This institution professionalized nursing, emphasizing education, discipline, and compassionate care. Graduates from the school spread her principles worldwide, revolutionizing healthcare practices across continents.
Florence Nightingale was not only a nurse, but also a pioneering statistician. She used data and visualizations, including her famous coxcomb diagrams, to demonstrate the impact of sanitation on health outcomes. Her groundbreaking use of statistics influenced public health policies and solidified her reputation as a meticulous and forward-thinking reformer. In 1859, she published Notes on Nursing: What It Is and What It Is Not, a seminal work that became a cornerstone of nursing education. Her emphasis on hygiene, patient observation, and compassionate care transformed nursing from a rudimentary trade into a respected profession.
Despite battling chronic illness in her later years, Florence Nightingale continued to advocate for healthcare reform. She advised governments, supported international sanitation projects, and mentored a generation of nurses. In 1907, she became the first woman awarded the Order of Merit by the British Crown, recognizing her extraordinary contributions to society. Florence passed away on August 13, 1910, at the age of 90. Her death marked the end of a life dedicated to service, but her legacy endures in hospitals, nursing schools, and public health systems around the world.
Florence Nightingale's impact on healthcare is immeasurable. She not only saved countless lives during the Crimean War, but also laid the foundation for modern nursing and public health. Her insistence on hygiene and sanitation revolutionized medical practices, and her focus on education and professional standards elevated nursing to a respected and vital field. Her work continues to inspire nurses, healthcare workers, and public health advocates. The annual International Nurses Day is celebrated on her birthday, honoring her contributions and the ongoing importance of nursing in society.
Florence Nightingale's life was a testament to the power of compassion, determination, and innovation. She transformed adversity into opportunity, using her intellect and empathy to change the course of history. Her story reminds us that one person's dedication can illuminate the path to a better world.